Niyathi. I'm one of the pharmacists and I work at the Arlington campus that's close by here. So I wanted to mainly go over Narcan. So the main things that I wanted to go over are listed here. I tried to make the slides as comprehensive as I could so that nobody has to write anything down, and that if you wanted to reference it, you know exactly where I got the information from. And then all these, everything that I put together, it's also on like the CDC, FDA websites, and there's handouts there. So if you wanted to print anything out, whether it's for yourselves, for other loved ones, then you definitely can. So I know some of this you might have already gone over with Dr. Weigold, so I'm sorry that if you have to hear it again, just let me know. Just nod your head and I'll kind of like skip through it. So the main things I wanted to go over is first, like, what is Narcan? I know, has anyone heard of the medication? Okay, so that's the main one that we're going over. I want to go over how does it work to prevent an opioid overdose, why everyone should carry it. So it's not just people who have like a problem with opioids, so like oxycodone, fentanyl, heroin, but also any loved ones that might know someone that basically has like an opioid prescription. Because even if you got your wisdom teeth removed and you have an opioid prescription, it's still nice to have Narcan in the house. So that's one of the things. And because we're talking about everyone carrying Narcan, I do want to go over some of the legal issues that sometimes people are afraid of, because they're like, oh, okay, why should I be carrying it, and will I get in trouble if I administer it to a bystander? And then also, what are some of the signs and symptoms? So what are we looking for, and how do we know when to administer Narcan? How do you use it? Because that's one of the biggest things. It actually comes as different supplies, so it can come as a single-use nasal injection, or it can also come as one that you actually have to put together before you administer it. And then there's also an actual injection, but the two that you're gonna see are the nasal forms. And then the last part I wanted to go over is how do you actually dispose of medications? So this is a question we get in the pharmacy a lot, and especially with opioids. So if anyone gets any sort of surgery, many times you're prescribed like oxycodone, Vicodin, Norco, anything like that. And the biggest thing is we keep it in our supply or medicine cabinet. We don't really get rid of it. We're like, oh, maybe we'll need it another day, or maybe someone else will need it and we'll like give it to them. Well, don't do that. I know everyone already knows that, but if you look at the statistics, there's a lot of people that end up starting opioids because they got it from someone's house. It's very easy to go in, grab it, take something, and you might not even know what it is, or you'll be like, oh, it's okay, maybe it won't hurt me right now, but then you end up having an addiction problem. And so one of the biggest things we're gonna go over is where do you throw it away? And it's usually not the pharmacy, but everyone always thinks the pharmacy. Everyone always brings us a bag of medications. I'm like, I don't know what to do with this. So the first thing is, what is Narcan? So if you look here, these are the two products that you're most likely gonna see. Has anyone seen these products before? Okay, what do you guys see more, the top one or the bottom one?
The bottom one.
The bottom one? Okay, that's good. So right now, you can either see both. So it depends on the pharmacy. Some pharmacies have a contract where they get the top one, which is a little harder because when you're like frantic and you have to put it together, if you don't know how to put it together, you're just gonna be more frantic. The bottom one's the easier one, and that's the one that mostly the pharmacies here is what I've seen that they carry. So, like we know, Naloxone is an opioid antagonist. Basically what that means is it reverses an overdose of opioids. So whether that's fentanyl, heroin, oxycodone, anything like that. And what we're going to talk about is just the two nasal sprays. So how does it work? You might have already gone over this, but basically, in the brain there's receptors, and if that's the oxycodone's going to the brain, hitting the receptors, and then starting to help with pain, right? But then one of the side effects is the shallow breathing. So if you take too much, it causes your brain to like lower how to breathe. So when that happens, when you give Naloxone, it blocks those receptors, so it doesn't allow the actual oxycodone or the heroin or anything to work. What's nice to know about this is that it helps restore breathing in 2 to 3 minutes. So right when you give it, you wouldn't expect the person to wake up right away. It just takes a slight bit of time, and in a frantic situation, 2 to 3 minutes seems like a long time. And another big point is it works for 20 to 90 minutes. And the reason that's important is because of the next slide. So you might need more doses. So naloxone only works for 20 to 90 minutes, but something like fentanyl stays in your body for 72 hours. So just that alone, you need a lot more naloxone to help with. So basically what happens is, say you administer Narcan for someone. So in 20 nights, they'll wake up, and after that, they might start getting drowsy again. So you're like, oh, what happened? I just administered it. Why is the person getting drowsy again? And that's because the naloxone stopped working because it's only in your body for a short amount of time. And that means that you have to administer another dose. And someone had a question earlier about how many times can you give Narcan? So sometimes you have to give Narcan multiple times. So I went to school and did most of my studies on the East Coast. And if you guys know, the East Coast has a lot more like a bigger problem with the opioid epidemic compared to here. What you hear about more is about meth, but on the East Coast you hear a lot more about oxycodone, heroin, fentanyl. And so over there, if you're giving Narcan and you have to end up giving another dose, you can. So basically you keep doing it and you keep giving Narcan until the patient's like responsive. The thing is, Narcan doesn't hurt anybody, and there's laws protecting you for administering it. So why carry Narcan? If you guys didn't know already, it saves lives. Whether you're saving someone that you know, someone that you saw on the street, and it has low risk. So that's why we want to try and get everyone to carry Narcan. And like I said, naloxone's very safe, and it doesn't have an effect on other medications. So say someone drank too much alcohol and you administer Narcan, basically nothing would happen. It's not like you're helping them, but you're not harming them as well, which is important to know. It can also be administered in pregnant women. So if you saw someone who's pregnant and you suspect an overdose, you can still administer it. But the thing that worries people is when you give Narcan, it leads to an opioid withdrawal. So basically what that means is once you administer the Narcan, the person might end up looking a little bit more agitated than they were initially. So here's like a symptom. So basically what withdrawal looks like is after you've administered the Narcan, someone might be a little bit more sensitive to touch. They'll seem like they're a little bit more irritated, and that's because you're switching everything that the opioid was doing, and so now they'll feel even worse, so they might be more angry when they're alert. They can have nausea, vomiting, diarrhea, and they can feel unwell. But the biggest thing to remember is that all of these are temporary and not life-threatening. So even though they're experiencing a really bad time and it looks like they're having more pain than they were in before, it's something that you still want to administer. Do you guys have any questions right now? Okay. So this slide goes over all of the states that are in blue have laws protecting you against if you administer Narcan. So that's basically like all the states. And what do they protect you against? So there's laws that prevent you from getting arrested, charged, or prosecuted if you basically help someone administer Narcan, if you yourself have any drugs on you, if you have any drug paraphernalia on you, you can't be charged, prosecuted, or arrested. In California. I don't know about all the other states. So now goes into what you're actually looking for. So if someone has an overdose or you suspect an overdose, this is what you would see. One is small pupils. So that's the first thing that you would look for. So if their eyes are dilated, then they might have taken a different substance. They're falling asleep or they're losing consciousness. So it doesn't mean that the person has to be fully unconscious. Even if they're like kind of getting drowsy, it's still something that you can administer. They will have slow, shallow, or weak breathing. So that's something you definitely have to check for before you administer Narcan. They might be making something like a choking or gurgling sound. They'll look cold, clammy, and they might have blue skin or nails. So this is what you look for before you administer Narcan. And then the main things you're supposed to do is first you're supposed to shout, try and get someone else's attention because you want to try and get someone to call 911, whether that's you or you're getting somebody else to do it. Then you administer the Narcan and you stay with the patient. or the person, and then you would start CPR, and then you would assess it. So the main one we're focusing on is now how to administer the Narcan. But before I do that, I want to tell you where to get Narcan. So has anyone actually purchased Narcan before? No? Nobody? Yeah? Okay, was it difficult to get from the pharmacy?
No, it wasn't. It was actually kinder.
Okay.
Yeah.
Okay, so I don't know if you guys knew, but pharmacies carry Narcan, and you don't need a prescription from the doctor to get it. So that's one of the biggest things. So if you walked in and you're like, oh, I need a prescription for Narcan, they would be able to give it to you in California.
Has that always been the case? Because I did tell Dr. Michael. I went to Sam's Club and they told me I needed a standing prescription, standing order or something to get it.
No, so that...
But that was like almost maybe a year ago or something.
No, this has been around for like at least like the last 5 years or so. The thing is, if they tell you that, you can... So I actually put like... So this is from 2018 and for California pharmacists. So you could even like bring them that and be like, well, it says here that pharmacists are allowed to dispense it.
Oh, okay. I know it's expensive. I think it was like $144.
So Medi-Cal covers it. It depends on what insurance it is, but they'd be able to process a claim just to check to see if your insurance covers it. And so how they cover it is they do like a 1-day supply. So then say you needed it again later, you can come back and still get like another Narcan. And so the one part about this that gets kind of tricky and people feel weird about is that say you're getting it for somebody else, like you want to carry it for yourself, pharmacists still have to put it into the system. So they'd still have to put it in under your account. So they'd still ask for your name, your date of birth. So people sometimes get hesitant to be like, why, it's not for me. And they'll put in the directions to be like administer like as needed, but it's still in your account, which people get weary about, but it really doesn't mean anything. It just means that you got Narcan.
Yeah, and I think I heard about it only because, I don't know if I heard it on the radio or I had read that anybody that is going through like recovery, because our son, we used to buy Xanax off the street.
Yeah.
You should always have it. And that's why I had gone to ask, but I couldn't get it, you know.
No.
But it's always been something, like the Dr. Michael said, to have on hand.
Yeah, and we actually started doing that. So at the psych hospital that we work at, or that I work at, they, for any patient that came in and if they did a drug test where they were positive for meth, benzos, oxycodone, anything, we still gave them Narcan when they were leaving, just in case. And so then as a pharmacist, we'd still counsel them to be like, hey, we're doing this, we're just giving it to you just in case, whether you use it for yourself, you use it for somebody else, and then we give them all the paperwork that goes with it.
So is that always? Because the time that our son was gone, they tested him, and he's always came out positive for benzos back then. He never gave
No,
him
this was
anything.
more recent.
Okay,
Because we were trying
because
to...
they never gave him anything.
Yeah.
Okay.
Yeah, it's because we started getting more Narcan, and since we were the ones writing the prescriptions, we're like, why aren't we doing this? So we tried to do it as a side project, just to be like, okay, everyone can have it, and it goes through the insurance. So this way, like, people have it on them. Some people will still refuse it and be like, no, I don't want it. That's like up to them, but at least this way we can offer it.
Oh, okay, thank you.
Yeah. So if anyone gives you a hard time, like, this has the information on there. So
Okay, thank you.
yeah. So like I said, these are the two products. So this one is just the one-time nasal spray, which is the one that you guys have mainly seen. And then this one's the one that you have to put together. So it comes in the kit, and then I'll show you how you're supposed to put it together. So what you're supposed to do, if you have the Narcan nasal spray, that's just a one-time dose, you're supposed to tilt the person's head back, you're supposed to support their head, and then you're supposed to spray it in one nostril. So you don't have to spray like half of it and then spray the other half, because that's what you have to do for the other one. So you just press firmly, and then if there's no response in 2 to 3 minutes, you do another dose. And the little kit comes with 2. Do you have any questions about how to administer this one?
I have a question. Say, for instance, if we're uncertain and the individual is in crisis, and his lips are blue, he's not breathing, could you administer 2 just to be on the safe side and wait instead of waiting the extra 2 to 3 minutes?
So it gets kind of, So they say to wait because if you give it all, you're gonna reverse all the opioids really quickly. So now they're gonna feel really agitated, unwell. So that's why they give you the 2 wait time. So as you're supposed to do it, you're just supposed to wait, just because if you do it all at once, then you might make them like unwell faster. Yeah. And it's because you have the second one on you so that you know what to do after if they're not breathing. And it's not gonna make it work like how it works is it still takes a while to absorb. So even if you did 2 at the same time, you'd still have to wait the 2 to 3 minutes, unfortunately. Because it still has to travel and get to the bloodstream. And then this is the second one. So this is what comes in the kit. You have this little plunger, you have the actual medication, and then you have the little piece at the end that goes into the nostril. So when you're supposed to open it, basically all the colored pieces you're supposed to take off. So you take off both yellow pieces, the red as well, and then that's when you have all your pieces that are ready to go. So when you take off the plunger, you're supposed to put the little red piece and you're supposed to twist it in the end and then put the nasal piece in the front. And so then that's when you have it ready to go. The only difference about this one is that you're supposed to spray half of it into each nostril. This one you don't see as often because they came up with the other one, but just in case you see it, you know how to use it. And you can always ask for the other one. The only way they wouldn't do it is if your insurance only has one on formulary, and then they'll only cover that one. And that's when you'd end up with this one. But Medi-Cal covers the other one, so I'm assuming a lot of other insurances cover it as well. And then this is a big thing, like I mentioned, to dispose of your medications. Anywhere you go, they give you opioids relatively easily. I just had my wisdom teeth removed and they automatically are like, do you want Vicodin or Norco or what do you want? So make sure you throw them away or keep them in a stored cabinet. Don't just throw them in the trash, but this website, if you actually go on it, it tells you where there's different drug disposal areas. And one of the easiest places to go is a police station. The police station's supposed to have a bin where you're supposed to dispose of unused medications. Pharmacies, some of them have it, but most pharmacies don't. So when you take your meds there, they're like, we don't know what to do with it. And then this is a list of everything that I've used in case you wanted to go back to it. Questions?
I have one last question. I noticed the Narcan has 4 ounces or 4 milligrams of what is it, liquid or, okay? What is the 3-step volume versus the Narcan of 4 milligrams?
Yeah, that's a good question. They actually made that, so that one's actually lower. And that's just because that one's the one that was made first. It's with the 2 milligrams per 2 mLs. And then the other one's the 4 milligrams.
So, okay, that's 4 milligrams, and then the number 2 is how many milligrams?
2 milligrams?
2 milligrams.
Yeah, because they'll have 2 mLs in it, and so each one is 1.
Now the other question, you mentioned milligram per nostril. What is the difference between applying, like you said, 1 nostril spray versus the 2 nostril spray?
That's a good question. Honestly, I don't know. That's how the company came up with it.
This is why I was saying that how do we know? Because if the individual, the loved one, is really out of it, and say for instance, you're putting less in number 2 and more in number 1, I mean, I don't understand how you can equate, what reaction the body's going to take. Why are we doing, less in one and then more in another one? Yet, if the loved one is dying, then we wait 2 minutes and we might wait too long.
No, that's a very valid question. The only way I can explain it is that different manufacturers made it, and they do their own studies. So whenever they make a medication, they have to do their own study, and they basically tell us how they're supposed to do, how they conducted their study, and how they did it, so that we can basically educate the same way. We can call them, but that's the best I can give you. Yeah.
Did I see, so when you administer the Narcan, did I see where it said you administer CPR?
Yeah.
So you administer the Narcan and then you start the CPR?
And then you start the CPR right away.
So that might work with what you're talking, because that 2 minutes, because you're administering CPR.
Well, the reason why I'm saying this, because I had our son go through that crisis, and unfortunately the sheriffs were unable to sort of react, because the sheriff that was there, my son's lips were blue, and the sheriff didn't know, and then I heard them talking, they said, should we get the nasal spray? But they were decisive on that action, and yet another officer came and he was just shaking him, and that what sort of woke him up. But this is what I'm saying, what decision, or how do we know? Because it looked like the sheriffs were questioning whether the spray was going to work or not, because they were asking, they were unsure of the product itself, because they were asking what he took, and I was telling them, it's Xanax, but again, no one knows. I'm not even thinking that, I don't even know if he was taking Xanax. It could have been fentanyl, but his lips were blue. I saw him, he was in the back of our truck, and it caught me by surprise. It taught me something, that even the sheriffs are not aware of what to do, because they look confused. The woman sheriff was getting emotional, which I was sort of like shocked. These are the sheriff department. And it took somebody else to come in and sort of like pull them out and shake them, because they didn't know what to do.
No, that's a really valid question. I don't know if Dr. Weigel knows, but if not, I can definitely call the company and try and see if they have more guidance.
And I know my son's a strong kid, because I know he takes a lot, and he was taking a lot of Xanax, and see, they didn't know. And so this is what I'm saying, that how do we know that, say for instance, an individual overdoses on the Xanax, and you notice the lips are blue, the decision to put 4 milligrams of spray and not wake them up, because the officers couldn't wake them up. It took minutes. There were minutes that went by, and 20 minutes that he could have died that evening, but it didn't. So now thinking of others, individuals that have not so strong an immune system or weaker body system that can die. I'm confused, because why there's less milligrams of that. Even if it's a two-stepper, I can understand that, but to administer half. No,
that logic makes a lot of sense.
This is the confusion. I just only a confusion.
No. Honestly, I haven't even thought about. So this is like a good question that you brought up, and if you give me your information after, I can find out and let you know.
Okay. And this is because if I see it on the street, I want to even assist and help somebody I want to spread the news out there, what we're learning, because the epidemic is bad. It really is bad, and some of us have seen it. We've gone through it, and I had an honor and a privilege to work a job that I had to work on the outside, where I interacted quite a bit with homelessness, and I saw it. I saw it on a daily, if not daily, every other day. I saw kids. These are kids that are ODing in riverbeds. But again, unknowing the circumstances, they could be violent, or there could be other people, watching that can react, and so it's sort of like you have to be on guard. But for God's sake, the way I look at it, it's a human, it's life, So the confusion, getting back to the product, is
I'd like to throw in real quick. I mean, she said it may have to do with exactly how they did the research. Because these are two different types of sprayers, it may have to do with the exact construction of the sprayer itself. And so in order to get enough Narcan into the system, the one that's more difficult to put together may be able to spray further back and get to more blood vessels. And so you don't need as much Narcan to get the same effect. It could be that simple. But we can absolutely look into this and get the information back to Pedro so we can get it out to everybody.
Okay. Fair enough. Thank you.
Because that's definitely something, like, now that you brought it up, like, I need to know, because why wouldn't you, that makes sense, that makes
I was
sense.
gonna say the same thing as the doctor said.
Yeah.
I'm a nurse, so I'm IC nurse, and we have this type of thing, and I was gonna say the same thing, that it could be the way that it's administered. Also, are the milligrams and mLs the same on each one of those?
No.
Because I know, so is it 2 to 1, is it 1 to 1, or is it?
So this one's 1-to-1, and it comes as a 2 milligram, or 2 milligrams per 2 ml. And then this one's 4 milligrams and 1 ml.
And you give half, so on the 2 ml, you give half, so half of that would just be 1 ml per
Yeah, so you give
nostril?
1 ml per nostril, yeah. And for this one, you give the full 1 ml.
Yeah.
So it could be that your nostril can only take up 1 ml
Right.
of a spray. But then you had the other point of like, why wouldn't we do the 4 milligrams in both? And that would just be 1 ml each, so that, yeah.
Are they manufactured by the same company?
No, they're manufactured, that was my other thing. They're manufactured by different people. And so basically they do their own studies. So it's like, and it gets hard. So I've called pharma companies a lot for lots of different medications, because a lot of things when we get questions, it's easier to ask them if they've done extra research. The hard part is they'll be like, this is how we studied it. So they can't give us a definite answer because they'll be like, this is how we studied it. And so then it makes it harder on us, because it's like, these are all other valid questions, but it's like, this is how they studied it. So it's like, we can't defer from basically what the evidence or the information that we have.
But could it be that because of unknown factors, so they may not know what the person had taken or whatever, so, I would think that they
Yeah.
don't know, have the information if it's this, that, or the other. So you gotta be very careful with that, because you can go to one spectrum to the other end if you don't know, you're not aware.
Yeah. No, that makes sense too. Thank you for everyone else's input, because.
Has a question.
Yeah.
Quisiera, si ella me puede decir, como estoy escuchando que algunas drogas están mezcladas con el fentanilo, ¿qué efecto tienen cuando se lo tragan?
So I'm hearing that some drugs are mixed with fentanyl. I would like to know, what are the side effects when people take these drugs?
When they take fentanyl?
Cuando toman fentanil.
Cuando se lo, o sea, sí, mi hijo era adicto y él estaba en un centro de rehabilitación y él consiguió tanto, no sé si quiere, yo lo que sabía que estaba era cristal, pero como estoy mirando que se puede entender esa droga.
So my concern is because my son he used crystal, and I would like to know, how would I know when the crystal that he's used contains fentanyl and when it doesn't?
You can't.
Oh, no, you got the microphone now.
Because this one occasion he was
No, él estaba en un centro de
okay,
rehabilitación.
so he was at a rehab center, and so that he wouldn't be catched using it, he swallowed it. He swallowed the crystal.
Okay. So I guess the best way to describe it is you can't tell just by looking at it if something has fentanyl in it. You can tell by the reaction that it might have. So if someone ended up taking too much of something, they would be displaying these symptoms. And if they are displaying any of these symptoms, then it means that most likely what they took was an opioid. So whether it was fentanyl or oxycodone or heroin or what was mixed in it, they would display these symptoms if they took too much.
Es que yo no lo pude mirar porque él estaba en un centro medical y cuando solo nos dijeron y lo tenían, cuando ellos recaen los tienen aislados y después del tiempo él salió y murió, se fue a dormir.
So I wasn't able to see him because he was at the rehab center. But then after when he was released, he fell asleep and he died.
Fue el doctor porque se sentía mal y le dijeron que estaba deshidratada.
He he went to the doctors, because he wasn't feeling good, he was told he was dehydrated, thank you. And then they told him to,
So the one,
yeah, and the doctor told him to go home.
I'm sorry,
And then he passed away.
I get,
He fell asleep and he passed away.
that could have been something else, I'm not sure, but if someone had overdosed on any opioid, then they would have, and they took too much, they'd have shallow breathing and they'd probably lose consciousness. Like they wouldn't be able to be walking and talking normally.
Yeah, I didn't see him, so I don't know.
Yeah, it's kind of hard because it wouldn't be days later. It would be
That's
kind
why
of,
I'm asking, because
Yeah.
I would like to know what actually happened.
yeah, for that, I'm sorry. I don't know.
Thank you.
Yeah, you mentioned it right now, but I was gonna say, one of the symptoms is slurred speech as well.
Yeah.
You know, I used to work in a rehab center and, we had an intake and he overdosed on us and I don't know how long it was, 10, 15 minutes, but we Narcaned him like 6 times.
Okay.
You know, 'cause we were, you know, and maybe a transfer to the guy's question, like, nothing happened, like, he came back, you know, we didn't see him responding, so we used like 6 Narcans on him,
Yeah.
you know, eventually he came back, you know.
Yeah.
I just wanted to share that.
No, that makes sense, and that kind of does go back to that point where it's like, if it's not gonna hurt, can you just give both at the same time? I want to just be like, yes, because I know if I was in that situation, I'd panic, and I can't even say I would wait the full 2 minutes. I just want to check, so if there's like concrete evidence, I can share that.
We have a lot of parents that sometimes they say that their children only use marijuana, right? They
Yeah.
only smoke pot.
Yeah.
But nowadays, you don't know. So for the families, I think it's a good idea to carry the Narcan, because you never know if they did that, what else are they going to get into? And sometimes there's stigma, or sometimes it's like, no, my kid only does this. Well, you don't know. If he already does something, he might get into something else, so prepare yourselves.
Yeah. No, that's a valid point.
Yes.
Yeah, and you can't know, like you can't tell, and a lot of even different drugs that you take, they kind of show some of this like similar responses, so it is better to be safe.
And ask Please Family Advocates, we'll figure it out, we'll get you one.
Yeah. I would just say our pharmacies now, it's different. It's like we only have an inpatient side, or else I'd just be like everyone can just come there. But yeah, if you guys need help, you can always call us and we can try and figure out a different pharmacy. Or we can call them to be like, hey, can you just get this manufacturer? Can you do this? And try and help set it up. Yeah.
Is there an expiration date on those?
Yeah, that's a good question. So the expiration date's always on the box itself. So whatever the expiration date's on that, as long as you haven't opened it, that would be the expiration date.
How would you dispose of it?
So same thing. You can take it to like a police station and throw it in. That's not only for opioids. You can dispose of other medications there too. Yeah.
I will say on disposing of the Narcan, if somebody says, ah, screw it, I'm just going to throw it away, it's not going to hurt anybody. If it got left out in the yard, it won't hurt my dog. So, if somebody's, if you find out somebody, oh, I just threw that away, there's no reason to be upset about that. Now, the Norcos, the OxyContin, the Vicodin, that stuff, absolutely. Don't just put that in the garbage. Don't leave it around. Don't leave it in your medicine cabinet for 12 years.
I have a question. I have access to Narcan, right? We have that. I work for both crisis response teams, and I work with Dr. Weigel. My question is, the temperature on that, like, so when we're working with crisis teams to keep it with us, because like just being in this presentation, thank you guys for both presenting, but just being in this presentation makes me think I need to even carry it, be more aggressively at having it, because I do get to see it as well, like the gentleman in the front, you know, so what is the temperature and what would be the recommended part? Because we're always in a car, so do you have any recommendations?
We're always out in the field, and days, obviously, as you know, get hotter and hotter, especially when we are driving all over the county.
No, that's a good question. So it's supposed to be at room temperature. So every medication that's like we store in the shelf is supposed to be at room temperature. What happens is if you go out, what can happen to the medication is it basically disintegrates. Doesn't mean, so it would basically lose efficacy if it reaches the wrong temperatures. But there's no like, if you reach 80 degrees, for 10 minutes, will it be messed up versus if it's 75 degrees for like 10 days. So it's supposed to be at room temperature, and I guess you do the best you can to try and keep it at room temperature. But it's kind of, if you haven't and you used it, it wouldn't hurt the person, it would just not be as efficacious.
Would that too work the same way as like, so, because we get different batches of, you know, so we don't, like, the expiration dates are differently, so like when we're going out in the field and having one, so if we were to administer like it expired yesterday, the efficacy would just be significantly lower. It's not like you can't do that and there's dangers, right?
Yeah, 100%. If it was expired and I needed to use it on somebody, I would use it.
Okay, because I would too. I'm with this gentleman down here. You're going to get 6 doses more.
Yeah.
Right? I mean, if you're coming back and you're irritated because you're coming down.
Yeah, I'm still on this question because I need it.
Right? I'd rather help you than bury you.
Yeah, no, it makes sense. And it's like if we can give more without harming the patient, I don't see I'm trying to see like why you wouldn't do it, and I can't see a reason yet.
Thank you.
Yeah.
So it's almost to the fact, like if you have I know it's different, but if you have insulin and it expired like yesterday or 2 days, but you're in an emergency situation when your sugar was 400 or something like that, you're like, oh, this is expired, I'm just waiting to die. So you're just going to give yourself insulin.
So insulin's old. So insulin definitely after certain temperatures, it disintegrates and doesn't work. So yeah, if it was really close to the expiration date and I had to, I would. But if it's like 10 days past the expiration date, I would have been like, please just get your insulin. So insulin's just a little different because it's just not as stable. But yeah, in an emergency situation, I mean, like anything that you think would help the patient helps. Really making me think now.
So as you're asking about the expiration, I'm thinking about, you know, the Oreo cookies in my cabinet have an expiration date. It was probably sometime in 2020. If I'm hungry, would I eat them? Sure. But dairy products, I think of differently. If that milk's been open for a week, yeah, I'm not going near it. And so insulin and Narcan, I would think of more like the Oreos versus the dairy. Does that help any?
Yes.
Now you know what I eat too much.
I'm raiding your office, Doc. I'm throwing away all the expired foods now.
All right, any other questions? All righty.
Okay, I'll find out these questions though, and I'll email Pedro. Yeah.
We have all of their emails, so we can just do one batch and send it over to them.
Okay. And if you have other questions about, I mean, any medicine related thing, you can just message us. I don't mind calling the pharma company if I don't know.
Do I call you when I have a question?
You call all the time when I have a question.
Because they always answer my questions.
So let's give our present. Let's give them a round of applause. Thank you, doctors, for being here, and thank you for being an ally. This is very informative for our families to know, and they can go out and branch out and let other people know that are dealing with the same situations. So we really appreciate you guys. Very welcome. All right, let's give them one more applause.